Hi, this is Amy. Just wanted to get on and share with you about our second diagnosis. Today we're going to talk about reading issues. And we're going to start our discussion with Samantha, a delightful, beautiful 10-year-old girl currently in mainstream school, struggling with reading difficulties. Her story did not begin when she was a young baby. She had all the developmental milestones were checked off. She developed appropriately. Language was there. Her story began when she started learning the letters. And right from the start, she had a hard time with forming the letters, having reversals, and especially since she was learning two languages, she had a much more difficult time with that second language. And the parents really tried to do whatever they could to support her. They had some private tutoring in place, but now at this point, her reading difficulties is impacting her ability to learn English and history and able to process information, and it's really impacting her in a significant way. So let's talk a little bit about what it is they've tried and how we can determine what questions we can ask to try and get to the root of the issues. So the first thing to understand is we want to know what was going on developmentally. Yes, perhaps Samantha was getting all those milestones in place. She was crawling and she was sitting and she was doing everything she needed to. But what did those milestones and how did those milestones look? Was she crawling fully with her belly up, making sure to have nice reciprocal movement? We know that when our children are learning how to crawl and creep on the floor, that's actually the first time that they're learning about crossing midline or the middle of their space and being able to track information and go across the page. So if she was having a hard time with those foundational skills, they would have translated into how she is reading. The second question we want to ask is, how are those reflexes when she was a baby? Did she integrate them? As we know, children are born with reflexes that allow them to survive during that first year of life or so. And after they're able to start being mobile and walking and independent, those reflexes fade away. Sometimes in some children, some of these reflexes remain, and they actually impact our ability to learn, to read, and to write. Were there some reflexes that maybe she didn't use as a baby, or maybe she used as a baby but didn't integrate and they're still with her, and that's preventing her from being able to read across a page, skip lines, form letters, look at letters, and perceive them correctly? That's another question parents would want to look at. A third thing we want to look at is, how is her gross motor skills today? Lots of children with reading issues may have a hard time with certain activities having to do with being still in balance, crossing midline like kicking or playing soccer, playing tennis, anything where we're crossing across our body. These issues and these difficulties translate into our ability to read and perceive information with our eyes. So we'd want to explore that and see, how does she move? What is she doing to compensate? Is she compensating? Is she crossing her midline? How does she look when she's doing her gross motor activities or her sports or physical activity? Another question to think about is, how is her vestibular system? In the brain, our visual and vestibular systems are directly related. We like to say that they're actually a coin. In the brain itself, they're running on the same maps. For those of you who are new here, the vestibular system is your sense of balance. How is her balance when she's still, when she's not moving her body? How does she get impacted by movements of her head? Does she get thrown off? Does the world change? Is she not able to perceive information? Children who have vestibular issues will sometimes follow up with having a hard time with their visual tracking and their ability to read. So you'd want to look into that. Now, when we think about Samantha's story, her parents did everything they could. They started with a tutor right at the start to try and do some practicing. And then later on, they did work on certain programs that were used for reading efficiency and proficiency, and yet those did not really help. Finally, they tried working on some vision therapy, which did help her significantly. Unfortunately, 6 months after stopping vision therapy, all of Samantha's progress fell apart. She again was having a hard time with fluency and breaking down the reading comprehension. Her processing was delayed, and all the subjects that were impacted with reading started faltering again. It was extremely frustrating, and the parents shared the information that sometimes vision therapy is not as effective or long-lasting if those underlying vestibular issues are not addressed. So overall, with all the information that we're sharing about reading difficulties, we know that this can be overwhelming. And in fact, with any diagnosis, learning about development, learning about what areas to be concerned about or to target can be confusing. And sometimes we need to get a little bit more clarity on what's going to be happening and what should be happening. With that in mind, we are so excited to invite you to this 3-day summit where we're going to go over brain physiology, give you practical tips on being able to identify the root causes of all of these issues. Looking forward to having you join us.